So, hey, we're here to talk about some serious stuff today. And I think those of you who have never been on one of these meetings before may know that what we do here is talk about some serious topics. We try to bring in some subject matter experts to help us have a better understanding of those topics. But we also try to have some fun with those topics as well. The whole purpose of this group and this meeting is to educate one another, support one another, figure out strategies of how to support each other, but also kind of what's going on in the Appalachia region. And so some of you may or may not know that there's a bit of a crisis, one would say, in Tennessee. And they say that this guy, Cory here, is the one. Yeah, that guy there, the one that just went, oh shit, she mentioned me. And because he was probably playing Tetris on his other computer. But he's actually going to tell us a bit about what's going on in Tennessee. We're going to start with him, and then we're going to get to Ramon. We've also got some folks on from some of our pharma partners, particularly those that are working in the policy space, because I think that, like I always like to say, I think that none of this gets done without our partners on the ground at the community level, the state level, our federal partners, but also our corporate partners as well, and our federal partners along the way. So, Cory, can you tell us what the real problem is here?
Yeah, I'll try to sum it up in a not lengthy way.
You
So
know,
basically,
we've got 55 minutes, Cory. You
okay,
really
perfect.
take
So
long as you really need.
I'll get into the
Okay.
nitty gritty then a little bit. So basically, a few months ago, the United Way of Nashville, who's our consortia here in Tennessee that distributes out the CDC funding in this endemic funds, as well as other CDC preventions funds for HIV testing, PrEP navigation, condom distribution, those kind of interventions. They were basically told from the state that they were no longer going to accept direct federal CDC fundings to receive grants directly from the CDC. So we found out a lot later on and asking a lot of questions that basically what happened.
Cory, I'm gonna interrupt you for a second because somebody probably should have warned you that I do that a lot. And so, how much money are we talking about from CDC to the grantees in the state? Do we think that they're talking about here?
Yeah, so AmFAR has a really good graphic that I can share, so we're able to kind of see the financial impact. But I know for us, it's going to be around 500,000, and that includes 340B revenue that we generate from our PrEP navigation in the East region. So that on top of everywhere else, and then Memphis is hit even harder because they get more federal dollars than anywhere else in Tennessee. So I will share that graphic in the chat that gives a good breakdown on the financial impact across the state.
Perfect, I appreciate it.
Yeah. So one, I guess the reasoning behind what we've found out from the state was basically that Planned Parenthood of northern Mississippi and western Tennessee was receiving CDC funding through the state. And so they basically wanted to cut funding to Planned Parenthood. And so they decided to just get rid of all funding altogether. Well, they actually did cut funding with Planned Parenthood. Planned Parenthood sued, saying, no, you have to give us the funding because that's discrimination. And so for them to get around that lawsuit and ruling, they decided to just get rid of all CDC funding entirely. So with that being said, come May 1st, we'll no longer be receiving CDC funding through the state of Tennessee as a pass-through. Some things that we're working on our end. Also, we've been meeting with the state, and they're promising us that they will fill it basically with state dollars with certain agencies. So not every agency that has gotten their funds cutting will receive direct state dollars. But we won't know that for sure until Tennessee passes their budget, which happens in April. So right now it's just a promise saying, hey, we'll give you some state dollars to cover for the fact that we're no longer receiving federal CDC dollars. We've also been in talks with the CDC to see if they'll directly fund agencies, which is a strong possibility as well. So the CDC is very committed to trying to make this work, even if they can't give it to the state. If there's like another pass-through entity that they can give, like United Way of Nashville again, or just give it directly to the organizations through direct federal funding through the CDC. So it's kind of the two routes that we're taking right now. The one issue is if it's just through the state, is we will no longer be a grant covered entity for our East Tennessee region in Johnson City, Tennessee, where we do PrEP navigation and prevention efforts in conjunction with ETSU's Center of Excellence, which runs an HIV clinic there. So most of our 340B covered entity income now comes from our FQHC status here in Chattanooga, but we still have our STD 340B ran through Johnson City because we received that CDC PrEP navigation funding. So if we lose that designation as a 340B covered entity in that area because of the loss of CDC fundings, we're in kind of dire straits on keeping that program running, which of course, as you all know, is in the Appalachian area of far East Tennessee. So yeah, that's kind of it in a nutshell.
So, Cory, let me ask you a couple of questions, and I'm going to go to some of our policy and pharma partners to talk a bit about kind of if they see this as a trend, and which is what I do. I think that this is going to be a trend that we're going to see in other states, particularly states that may be redder than others, and definitely will impact those in the Appalachia region. My bigger question is this: is that even if the state says, okay, we're going to make funds available, will organizations have to go back and write grants to apply to the state? And do they have the capacity to do that? And then if the CDC says, yeah, we'll direct fund a couple of you, do they have the capacity to write a CDC grant? Because that's a whole different animal.
Yeah, I mean, I think at the end of the day, the smaller organizations are the ones getting hit the hardest because they rely the most on grant funding. Like a lot of them don't get 340B, for instance. And so like almost 80% of their budget sometimes comes from these CDC grants to even operate, especially the smaller ones in the Memphis area. So I can see a lot of them having to shut their doors if they don't find an alternative funding, which again is the majority of their budget, and also small, like you said, smaller ones. Writing for federal grants, I don't know how many of y'all had to write a federal grant before. It is not easy. You have to make sure you're registered with SAMS and all this other huge process. It is not as simple as like some of the smaller foundation grants are. So it's a pretty complex operation to even operate at the capacity to apply for federal type funding. So yeah, and it seems like the state is only focusing on giving money to the larger organizations. Not that we're a huge organization. We have about 83 staff, of course, in two regions. But like a lot of the like 5 or 10 person organizations, they just don't have that kind of capacity. And I think because they don't have as large of a voice in the state's not reaching out to them to necessarily, I think, appease them by handing them dollars over.
Right. So you said a couple of the questions that I have. How many organizations do you think kind of meet that larger organization tier? Like, is that we're talking 5 organizations, 10 organizations? That's one.
Yeah, probably
question.
about 4, probably 4 or 5. So it's probably going to be like Cempa, us, Nashville Cares, Choice Health Network. I think it's like Friends for Life. There's a couple of other larger ones in Memphis. So it's probably only about maybe 5 or 6 total organizations that they've really, I think, been in direct contact with.
Now, would those 5 or 6 organizations be able to assume the smaller organizations into them as some sort of umbrella, some sort of consortia, some sort of some?
Oh, that's a good question.
I try to ask one per call. That's all I get.
Yeah, I know for us, we're pretty concentrated in just our one region. We don't have that many other players in ours. Nashville Cares is a lot bigger than us. They might be able to help out in the Middle Tennessee region. Memphis is kind of its own beast. There's just a lot of organizations there. So I don't know how they might be able to consolidate under Choice Health Network, or they might be able to assist because they do receive a lot of revenue from their 340B program. But we have not been in those direct talks because we really aren't. We're not in those regions. There's other players in those regions, so we kind of just stick with our area, which is just us in Southeast Tennessee. So
okay, all right, Ramon, what's going on in your world with regard to what's happening in Tennessee?
Yeah, so
first of all, I know you. Introduce yourself to the people who don't know you.
You're absolutely right. Thanks for the reminder. So Ramon Gardenhire, I am with ViiV Healthcare. I'm our Director of Government Relations for the South region. So I cover everything from Texas up to Alabama. And before that, I spent about a decade at the AIDS Foundation of Chicago in their policy and advocacy shop. So very steeped deeply in HIV. And then Tony, your question was from like a pharmaceutical perspective, are we concerned? Absolutely. I think we are really concerned about the point that you brought up before, that this could be a domino effect, that we could see, other really conservative states picking up this kind of this mantra of rejecting CDC funding for prevention because it's targeted to certain populations that unfortunately are under legislative attack in these states, right? LGBT, trans individuals, women's reproductive health rights. And so I think that these are we have to be very mindful and working to make sure that this doesn't happen. I know that we have been working a lot with our state partners in various states to kind of get a read on if they think that this could bubble up. Fortunately, nothing has materialized to date, but every day you have to be on guard and watch and see does something materialize. But so far it has only been isolated to Tennessee, which is a good thing.
Right. So Dawn, I know Dawn has another competing issue at the same time, so she'll be popping in and out. Dawn, are you here?
I'm here.
And so Dawn, can you introduce yourself to the people of the people, and let the people know who you are and kind of where Merck is in this? And I have a question for you and Ramon.
Fantastic. So I'm glad to be invited to the call today, Tony. I'm Dawn Patillo Exum. I work for Merck and I sit in our state policy department. So I sit in headquarters. We do have 13 registered lobbyists in the states that work with our partners on the ground as it relates to legislative issues. Our remit really is to make sure that there is access to medications and to make sure that we support policies that do promote patient access to our medications.
So with that said, one of the things that I'm hearing on the street, that was at street for those of you who are urban versus rural, and is that the question becomes whether it is for you at ViiV or whether you at Merck or or Big Red, as I like to call them, is whether or not this is a place where pharma should do backfill for what's happening with the states. What do I mean by that? Should pharma pony up the money that is being lost in a state like Tennessee? Should there be a fund that is put together to support these organizations? You know me, I'm always begging for CEG, but now I'm like trying to beg for kind of some sort of structure that makes sure that we can support these organizations' sustainability. Because Dawn, as you just said, one of your remits is to make sure that folks are able to access the medication that they need. I think that ViiV has, particularly new products on market, like it's, injectable PrEP, which we want to make sure people have access to. You can't do that if you don't have the organizations there on the ground that are able to access community to get those folks online for those treatments. So do you guys think about like maybe creating a fund for, the organizations that could, as I think as Cory stated earlier, some may close if they can't necessarily get resources from the state or federal government, and many of them don't have the capacity.
So Tony, I think that's a great question. And I think every pharmaceutical company has their own guidelines for funding. So as it relates to Merck, our funding is not to basically keep the lights on for organizations. And I do understand the competing priorities for these organizations, particularly in light of what's happening in Tennessee. For us, at least from a state policy perspective, the funding really our guidance is around how do we support organizations that talk to legislators to make sure that legislation that's being proposed is in line with patient access. As it relates to those organizations who do that, if they are doing any type of capacity building or actually doing any lobbying at the state capitals, that's what we fund. Unfortunately, we do not fund organizations to keep their lights on. Our guidance is that, we should not be the reason why an organization stays in business. And I know that other companies have different guidance as relates to funding.
That was good. You're in the policy department, aren't you? Ramon?
Yeah, I mean, I think as Don alluded to, we all have different kind of protocols in terms of like our funding mechanism, and I want to be transparent. Our government relations shop is not the grant giving shop at ViiV, and so there are other functions within our agency which kind of spearheads that. Now, I do know that there are existing mechanisms like through our HIV community, HIV positive grants, and I think those are opportunities for organizations, as Don was mentioning, which are really kind of leaning in and removing access barrier, whether they be legislatively or policy wise, that organizations could tap into. Again, no guarantees, but I do think there is an opportunity there for folks on the ground there to leverage those kind of existing funding streams. In terms of your broader question, Tony, about is there an opportunity to backfill some of those? I don't know if we are having those conversations, to be quite transparent with you, but I do think it's something that I can go back and say, hey, communities clamoring for this, maybe it's worth the conversation.
Yeah. I would honestly say, I don't want to speak for Cory because I'm going to ask him another series of questions. He's like, I don't know why I agreed to do this, but but here's the thing. I think that for you, Ramon, for you, Dawn, I do think that this is an opportunity to maybe, even if you can't do the backfill, is to really to start to rethink how we're doing funding in this kind of policy arena, because many of these organizations don't have policy shops, right? There's organizations like ours which try to move across the 13 states or the 423 counties of Appalachia, but we don't necessarily have the know what each one of them needs. So I think maybe even kind of a small focus group in like how is this going to impact organizations? How is this going to impact them long term? What are the policy objectives that could move at the state level or federal level, and that folks are being able to do that in unison? So, Cory, I'm going to come back to you. And Marilyn, I think you should get ready because I'm coming to you after I talk to Cory for a minute. That's Marilyn Francis, that would be you. I'm going to ask you a couple of questions in a second. But Cory, if I said to you, which I'm about to say, what do the folks in Tennessee need from its partners around the country, in the region? What do you need us to do?
Yeah, it's a good question. I think the atmosphere in Tennessee right now, and I've lived in Tennessee all my life, it's very more red than it's probably ever been in terms of the policies and the far right policies they're putting in place. Of course, I'm sure everyone knows about the drag bill that's passed, as well as the trans youth health bill that's passed, and some other legislation that they're trying to put down the pike, including I think a bill right now where they can basically allow where county clerks don't have to approve of same-sex marriage license. So I think from a political standpoint, if we could focus on, because in the day, money grants, that's all great, well and good, but we're going to continue to have these fights with the state unless something politically changes. So I think having people across the country start focusing on hopefully turning Tennessee maybe like a Georgia, where a little purple, focusing on getting better candidates out there. I don't think anyone's ever focused politically on Tennessee. It's always chalked up to being a red state, and so there's never been a political presence to do any, I think, advocacy or policy to do anything that changes the political landscape of the state, like you've seen in other places like the Carolinas or Georgia and things of that nature. Or so I think getting more attention and more political dollars in Tennessee is going to do way more than anything else could do. And also, I think, give a message to the politicians that they can't just keep voting down party lines, which is what's happening, because we've had plenty of Republicans on our side in the past on state legislation when it comes to 340B or some other like HIV criminalizations and things of that nature. But when we confronted them about, you know, what's going on, like for the drive bill, for example, they're kind of just like, well, it's going to pass anyway, and I don't want to fight my party on it. Then it shows, I think, a level of comfort the Republican Party has in Tennessee that they just don't care about any other. They don't care about the political consequences because they know there's not going to be any. That makes sense.
Right. So let me ask you one more question before I go to Marilyn. What do you think? How do you think we can help to organize, mobilize? And I think the word for me is always more mobilize those smaller organizations around policy concerns. See, because I always say that I think those are the organizations that need a policy shop more than anybody else, but those are the ones that can least afford a policy shop. And so then it's the question of how do we get them to think about policies which are 6 months, 18 months, 2 years down the road, but are going to impact them, you know, but how do we get them to think about it? What are the tools that we need to provide for them? What are the opportunities for learning and training that we need to provide for them? Because I think that maybe that's some of the stuff that a ViiV and a Merck might be able to do is, you know, training opportunities on how do you read a policy? How do you read legislation? How do you think about it? Because I got it, you can't keep the lights on, but we've got to give these organizations tools for survival in 2023, 2024.
Yeah, I mean, I think for smaller organizations that workshop trainings is important, but then also funding to let them see their policymakers in Nashville. Like it's a pretty decent drive. We're a long state, so driving from Memphis to Nashville is kind of a trek. So having dollars set aside to stay in a hotel so they can meet their policymakers fresh the next morning in person, because more those in-person talks and meetings are going to have a larger impact than, you know, sending them a letter. So I think some support for travel as well as training on how to have those one-on-one conversations with some of their policymakers. And also had to talk across the aisle and maybe with some strategies about, you know, they may not see it from a moral standpoint or a cultural standpoint, but from a fiscal standpoint, they might change their mind about, you know, how these dollars could be going somewhere else and how, you know, like the MFAR one I shared about what the actual impact is going to be on the state budget long term. They might get more out of that than trying to have a cultural or moral argument with them. Dollars, especially on the Republican side, can sometimes speak louder from a budgetary standpoint, which is also interesting. I think that's one reason why Tennessee has gone so rejection on federal funding. There's actually an article I saw the other day where they're contemplating rejecting funding from the federal government for education, which is just insane to me. But Tennessee has gotten a lot of money ever since COVID. There's a lot of people that have moved into Nashville and these other cities in Tennessee. So they're seeing these huge budget windfalls where they have tons of money in their coffers. And so it has emboldened them to be less fiscally conservative and be willing to reject these federal dollars. So I think I'm talking about from a fiscal standpoint, how irresponsible it is and how they may be really good right now financially from a state government standpoint. That might not always be the case. So.
Thanks, Marilyn. I'm wondering what you guys are doing over there around kind of, as you know, I think I kind of believe that this is the tip of the iceberg and something we're going to see more of coming down the pike, whether it is around reproductive health or reproductive justice issues, but also around trans issues moving forward. What are you guys seeing, or specifically around Tennessee, but also just more broadly?
Okay, I just want to make sure I understand your question about how other people are looking at this and considering it, maybe.
Yeah. Yes.
And so we're really tracking it.
Well, tell the people who you are, because I know you.
Oh, I'm sorry. I don't know who I am. I don't know. No. My name is Marilyn Francis, and I'm the Director of Health Policy and Research at AIDS United. So nice to see everybody. But so we are really tracking this. You know, Drew is doing some tracking and doing some work with Nashville Cares to see, to get our vision and, our talking points together for when they do talk with some of the state people. But during AIDS Watch, we're also going to be having a Hill Day. And so we'll also be talking about Tennessee. We are really concerned about other states, especially the more red states, non-Medicaid expansion states taking us up and what would happen. And we're going to have a discussion about this with our Access to Care and Prevention Committee on the 23rd to see how we can, rally together a little bit more collectively to get the information out about how this really can hurt a lot of people and really kind of, negatively impact the progress we've made in terms of HIV care and stuff. And, what you brought up in terms of, I think Cory brought up in terms of, states may have the money now because of the PHE and what happened during COVID. I don't think that they're really looking at the long term about being able to sustain, the care that they should be providing people, especially when they are not accepting the federal funds. And so just doing a lot of the research on the, the statistics now and what the potential could be if they really draw back funds and are not providing the care that people need. Does that help?
It does help, but I also want to kind of make sure that we talk a bit about, because one of the things that Cory, you mentioned, I think at least twice, if not 3 times, is that this has the potential to have impact on organizations that are receiving 340B funds.
Right.
And what we know is that a lot of organizations, not a lot, but many, I'll go with many organizations have been able to expand service delivery through the 340B program. So maybe Cory, Marilyn, maybe you could talk for a minute about what 340B is. I know some pharmaceutical companies have one position on 340B, some have another. So I'm not going to ask us to debate the viability, vitality, or value of 340B as much as I want to say, what is 340B, and so that other people understand what it is.
Yeah. Well, to be very basic, the 340B program enables especially federally qualified health clinics, Ryan White clinics, to be able to buy medications at a discount price. And then the pharmaceutical company can provide a rebate between the market price and the, the price that they get, the discounted price. But the rebate that they receive must be used for services to people. And so that's services such as, transportation, mental health services, other services that they're not able to cover. So it really does enable clinics to provide more comprehensive care to people. And so it is important for it to move forward. I don't know, Cory, if there's anything you wanted to add to that.
Yeah, so kind of breaking things down on how 340B impacts us. So we are able to get 340B because we receive Ryan White Part C funding, direct federal. And we also became a FQHC lookalike about 3 years ago. And then we obviously get, there's a 340B STD designation as well. And so there's a lot of organizations who maybe not even have clinics, for instance, who maybe only get CDC funding that fall under that STD 340B designation. And so one special thing about the 340B designation versus Ryan White, for example, is you can only spend the funding under a certain scope. So for the Ryan White 340B, for example, you can only spend it on Ryan White related activities. 340B STD is a little special. It doesn't have those restrictions, so you can kind of use the revenue for anything. So a lot of people have used that designation to expand a lot of different services across the board, as well into different areas. They've also gotten like in-kind designations, which is kind of a mixed bag. But like Music City Prep, for example, out of Nashville, which provides prep services across the state of Tennessee, receives 340B designation because of their 340B STD designation. So pretty much all of their revenue is minus private payers is pretty much generated from that 340B program. So without the state receiving those CDC fundings, there's no way for the state to designate 340B STD entities or for organizations to receive funding through the state under that grant guise. So for a lot of organizations that do prep navigation or provide prep services, that revenue stream pretty much dries up.
Mhm.
Right. Okay.
Yeah.
Do we have? I mean, I thought I saw at least one person on from Mississippi. Do we have anybody on from Mississippi? And I'm asking about Mississippi because all indicators are Mississippi's the next place we're going to see something very similar. Are you seeing that, Ramon? I think you take care. You cover Mississippi as well.
I do. And so we have not seen anything squarely related to what's happening in terms of rejecting federal funds from Mississippi, thankfully. And, as I said before, got to play every day individually, because it could turn on a dime. But I do think there are some concerning things happening in Mississippi. I know that most recently, the director of the HIV STI office is no longer in her position, and there has not been an articulation of like what the transition of that leadership for that office is going to look like, which I think is concerning. I know that the state has put their HIV planning council on pause, and it's been on pause for an extended period of time. And obviously, planning councils are critically important to making sure that resources are directed to, the most targeted communities that need it. And then I know that there are a couple of organizations in Mississippi which have provided work to the state around prevention and treatment and are still waiting to be reimbursed for those services. So I think, there's a tinderbox there of things happening in Mississippi that we should be mindful of and making sure that we have a pulse and working with amazing partners. I know, Linda Dixon's on the call. They're an amazing partner, and others in Mississippi who are doing the great work on the ground there.
Right. Linda, are you here? In name only. All right. So, I mean, I think
Tony, I'll
hey.
share. I had reached out to Linda and she was not aware of this issue when I reached out to her. So this is news to her.
Okay. But I mean, I think that one of the reasons I'm asking too is then what do we all need to be doing, right? Because I think that these things will pop up like a game of whack-a-mole. We're going to have Tennessee. I think we're going to have Mississippi. I think that we are going to have the ongoing housing debacle in Georgia. I think that, we've not responded, I think, right or well to the Hopla crisis in Georgia. I know that's not within the Appalachia region specifically, but I think that it's a part of this kind of ongoing Southern conundrum that we are seeing. So, I'd really like it if people could maybe take a minute and talk about things that might be going on out there that we don't necessarily know about. Because I think that we've got to ask folks like Dawn, and folks like Ramon, maybe it's not to keep the lights on, but it's to keep a spotlight on the issues that are going on in these jurisdictions. Because I think because often that they're Southern, often because they are honestly browner and blacker and poorer, they don't necessarily get the attention and recognition of New York, LA, Chicago, that we really think that they need to have. You know, and I think that, again, I just don't, in my core, I don't believe Tennessee's the last. I think it's the first. You know, I think we had an issue last year where some states had overspent by a great deal on their Ryan White funds. And in some cases, in, you know, Texas, the governor came in and used some COVID funds to augment that. But again, we talked about it, then that happened, and then we shelved it and we didn't talk about it anymore. But I think that these are the kind of things that we have to not necessarily, I don't want to say cover up, but I think that when it gets addressed and all of a sudden we don't talk about it anymore, this is kind of the reason for this kind of call, this kind of group, is that we're in this together. This isn't a competitive thing about me trying to get a grant so Maryland doesn't get a grant so we can address the issue for Tennessee and not them, but that we've got to figure out how to do this strategically together. And so I'm wondering, what are some of the other issues that are on the table? You know, I know we're doing a lot of work around opioid settlement dollars, particularly in this region of the country. I wonder kind of how that's going to play out and play into all of this. I wonder what happens to those organizations that may lose money in Tennessee. I think we're not talking enough about what's happening with hepatitis C and B in these same states that are being impacted by HIV and substance use disorder. I think that there's a lot of work that we need to do collectively. So I'm wondering if there's something out there also that we don't necessarily know about. Anybody
Tony,
can jump in.
Tony, I'll dive in first. There are, I think, two issues that are, I think, a paramount concern that I'm seeing that can have impact or ripple effect. One is that, as you were mentioning with ADAPs, and I think that as the public health emergency starts to unwind, there are many folks who are currently on Medicaid, which are going to now go back to ADAP roles, right? And I think that I hope folks are working in partnership with their local ADAP programs to make sure they are talking to Medicaid so that they have a plan so these people are not lost into care, and also that they are ready to reabsorb the number of people that will be coming in, because that's going to have a financial hit on ADAP programs. And we do not want to see states implementing waiting lists again or restricting access to critical, biomedical, interventions. So I think that's something that is paramount that I'm always up at night worrying about. It's just like, there's a wave about to hit, and we just want to make sure that folks are working to make sure that folks are not lost to care. And then the other thing that is really concerning to me comes out of Texas, which is the Braidwood versus Becerra case, which there is a lawsuit pending that basically seeks to gut the ACA's protective no cost sharing measures. There is a lawsuit filed by two Christian organizations and 6 individuals, basically saying that the federal government does not have the right to mandate that private insurers cover without cost sharing certain preventative measures, and specifically they target PrEP. Because of the populations that most utilize it. Now, the district court has ruled in their favor. We're just waiting to hear what the remedy will be. It could be as local as just Texas. It could be a national ban, right? Then it will likely probably be appealed and work its way through the Fifth Circuit, which tends to be a more conservative leaning circuit. And then it will work its way up to the Supreme Court, which, I think that all of us probably have pause about how that could play out. If this comes out in a way that underroots the ability for people to access PrEP without some of the cost barriers associated with it, I think this will have a dramatic effect on us being able to reach our national goals around HIV prevention and treatment.
Perfect. Thank you. Dawn, what are you guys seeing as the here's what I need community thinking about, looking at, focusing on? again, this is like, we're in partnership with you. We're not fighting against you, you know, yeah.
Right. So Tony, I think, what really is coming out of this, and I just want to put an exclamation point on it, is that everyone on the line is their involvement in making their legislatures aware of legislation that's being passed that will be detrimental to them. And as much as you would like to see Merck's of the world, the other pharmaceutical companies really engaging around this issue, it's really the voices of those with the lived experience that has the words and can really express the impact of what legislation would mean to them from a treatment perspective. So that's the first thing I'm going to say. The second thing I'm going to say is that I agree wholeheartedly with Ramon as it relates to the rollback of the emergency order. I think the other thing that we're also concerned about is what is that going to mean for telemedicine? And particularly when you're thinking, and for physicians being able to either pick up the phone or to see people via their devices, and those reimbursements that are very similar to what they see, how they see patients in an office. That's of concern to us as well, because even in urban areas, people are busy, et cetera. Transportation's an issue, and if you have an opportunity to talk to your health care provider phone or via Zoom like we're doing today, you have people stay engaged in care and their outcomes are better. I think the other thing that is really starting to keep me up at night too is that now states are back in legislative session post the federal legislation of the Inflation Reduction Act. And what ultimately is that going to mean? And so for those on the line, there are many different provisions to that, but the one thing that we're paying attention to is the of CMS being able to negotiate prices of the most expensive spends in Medicare. And so as you can imagine, as people living with HIV and AIDS are getting older, they're going to be Medicare beneficiaries. And so, most of the drugs right now, the top 10 list is primarily oncology drugs, but there is an HIV drug there. And so what is the downstream effect of that? What is going to be the access of all of antiretrovirals to if those drugs are not negotiated? And more importantly, is there going to be spillover in the states, and particularly for Medicaid? And what does that really mean? And what are the unintended consequences? And we're seeing that materialize in the form of prescription drug affordability boards. And as you can imagine, if Medicare is getting, a drug for 5 cents, Medicaid is going to be like, why can't we get that same drug for 5 cents? And the commercial plans are going to be like, why can't we get that drug for 5 cents? And so what does that do to innovation? And for, pharmaceutical companies thinking about, new drugs that they want to have in development.
So so is that thinking that it will have a long-term impact on R&D, research and development of new products? So, so that, because my understanding of the law that passed, and nobody should really believe me about what the law passed is that what it was saying is that because in the past, Medicaid, and maybe we should spend a minute on this, is that Medicaid could not negotiate its prices. And now the law is that they can negotiate their prices. Is that right? That's the oversimplification, right?
Yes. So the federal law specifically is looking at Medicare, but
okay,
states are trying to implement their own laws to say that they want to be able to put in place some type of upper payment limits, meaning what is the maximum price that they want to pay for state-based plans, so i.e. Medicaid.
Right.
There's still a lot to uncover there, but that's what we're thinking about right now to see how is it ultimately going to play out. And this year is going to be very interesting.
Right. So Marilyn, are you seeing this kind of conversation around billing, paying at the federal, with your federal part? And when I say federal partners, I mean those across the, AIDS United landscape?
We haven't really had the conversation around the Medicare and price negotiations as much, but have had discussions about, the drug pricing in general. and how it impacts our communities, and what is the best approach in terms of making sure that these drugs are affordable and available to people. I know that doesn't answer your question specifically, but that's some of the conversation.
I mean, probably close enough for government work. Listen, there's one person who, and she's gonna be like, "Why in God's name is she calling me about this?" Because God knows I don't know. Hey, Lynn O'Connell.
Why did I know that was coming to me?
Because you know me all too well, Lynn. And so, Lynn, can you introduce yourself a bit to the people, and then I'm going to ask you a couple of questions because Lynn, you're like the West Virginia Oracle. You're like the Oracle of West Virginia. Yes, you are. You're the Oracle.
There are far more educated folks than me, but I'm Lynn O'Connell, and I work for the Joan C. Edwards School of Medicine. And I am the person Tony calls on sometimes, and it scares me. So I'm here just a little nervous. This is not my wheelhouse. I run our division of addiction sciences.
I know you do that, but you are also in a lot of the rooms, I like to say, where a lot of the decisions get made around a lot of these things, or where I'm going to say a lot of the thought leadership goes on around these issues. And so what I'm wondering is, have you been hearing at the state level, because I know you're in a lot of those, and I'm not asking you to divulge any top secret information, which I know you have at the ready also, but have you been hearing anything about kind of this issue around Medicare, Medicaid, about billing, about any of this sort of stuff at the state level?
I do know that the state is aware of these conversations, but I find our Medicaid and Medicare offices to be very responsive to community needs and opening up greater payment structures when given the infrastructure to do so. So, in the past year, they've expanded, for example, with pregnant and parenting moms and extending that reach with ensuring that their services provided up to a year and creating more bundled payment strategies, looking at underserved communities and why payment structures haven't supported them in the past. And so I've really found them to be compassionate more on these issues than I'm really hearing sort of some of the horror stories that are now going to keep me up at night over Tennessee and other areas.
Well, and so if I called you up and I told you the horror story of what's happening in Tennessee, what would your recommendation be about how to get academic partners maybe even engaged in this? Because that's what I'm still not hearing in the Tennessee part. I'm hearing community-based organization, state-based organization, local county health department, state, federal part, but I'm not hearing academic partners. And that's really what you are. So tell me how I get my academic partners rolling here.
Well, I got to be honest, that was going to be my only suggestion and ask if that had been done. And I imagine, the greater experts on Tennessee and their experience there. But are the health systems and the larger academic, you have brilliant universities there. Where do they stand on speaking out about this, whether it be publicly or, as we know, in some cases, we do it behind the scenes, unfortunately, because there's things that we can't sort of come out and say, or, we've just ended our legislative session. So taking a giant sigh of relief that tomorrow I don't have to look at agendas in the morning. I'm sure Lee feels the same. But, where we're at in West Virginia, there was a constant maneuvering sort of in these sessions with our academic health system saying, that's great that you want to do the political grandstanding maybe, but this is going to be a huge drain on our health system. I mean, proving to them the cost that this is going to have, both short-term and long-term. I can't imagine a CEO of a hospital or a medical school that would want to see this kind of impact. So, are they recognizing that? That's how we got everyone on board with, opioids, was people being dropped off in the emergency bays and the car rolling out, and, no payment system and drain on the system and endocarditis and all those other effects. because yes, the money talks. So where are the universities and those health systems? And can the university step in and do some research if you don't have those cost centers already identified? I don't know. Maybe they're at the table and this just Tennessee's legislator is doing what it wants to do no matter what. And that has seemed to be the way this year.
Well, Cory, I'm going to let you answer that, and then Marilyn.
Yeah, so we've had some university partners. Actually had Vanderbilt reach out a couple of weeks ago asking for our numbers on like the impact, and they reached out to other ASOs. So I think they're trying to do some of their own research to make an argument among legislators. But I think they themselves are trying to be careful because part of the reason why the trans youth health bill passed in Tennessee was because of the work that the Vanderbilt was doing with their trans health clinic, and so they're kind of also under the radar right now with the state. So it's kind of like catch-22. It's like they want to be advocates, but they also get a lot of the funding from the state, and they don't want to get cut. So so yeah, it's been a challenging, but we had a lot of partners reach out to us just trying to collect numbers and on the impact. So I think they can try to weave together and tell a story. So I think that's always been helpful.
Perfect.
Yeah, and I do think that, and I've been pushing for the fact that it is important to get some of this data, because especially when we're talking on the Hill, to be able to tell them what the impact would be, the numbers, sometimes brings more attention to it. And, you know, I would like to see us do more predictive analysis, you know, based on what we've already collected and what, you know, the change in policy may have down the line. Because unfortunately, a lot of times in the policy world, they'll think about the short term, but not necessarily the long term. And, you know, I've been in policy enough to see how, you know, yeah, it looks great. You know, it looks like it's going to work in the beginning. But then as you really look down, you know, 5 years from now, it really can have a negative impact. So I do think that there really needs to be more partnerships with the academics that be able to help us craft these stories or research papers that can be shared and really give the information about, it's not just about today, but what's going to happen tomorrow if you do or you don't do such and such. So,
You know,
Tony,
Cory.
can I ask?
Yeah, go. Sure.
Tony, can I ask one more question? I'm thinking, so in the way that this group, you know, functions and having people from across state areas, obviously, you know, Medicaid's different in each state, but is there an argument to be made that Virginia and North Carolina and Kentucky have something to lose when Tennessee does this, that people may have to travel to Louisville or Asheville or Blacksburg, Virginia? You know, there's something like, I think of Blacksburg because I was there, but you know, that people are going to these locations because of this change in Tennessee. And so it's not only Tennessee's representatives that need to be held account, but pointing out to those local border towns and states that you may face the financial impacts of this. And so in Huntington, we face the financial impacts of Ohio and Kentucky, because if they don't have a treatment center, they're coming to Huntington. If they're not obtaining neonatal abstinence syndrome in, you know, Ohio, they're coming over to West Virginia. And so the policies, you know, problems don't stop at state lines. And so how can we highlight to these legislators, you know, that this matters to ours without giving them any idea of policies that have been implemented in other states, of saying, you know, this is not a Tennessee problem, because, you know, the same in West Virginia. If it's Huntington, I couldn't be further away from Danielle than I am in Huntington and still be in the state of West Virginia. And the same is true in Kentucky. You know, if you're in Memphis versus Knoxville, you're not neighbors. You actually have a closer issue with, you know, Mississippi and other parts of the state. So is that a strategy we've tried or could help with? Or
I think that's a direct question for you, Cory.
Yeah, I don't think I also think they don't factor it in because that means that have to be logical. I don't think, they really look at the financial impact of other states. I do think they look at other states for legislation. So like, you know, how other states are going to look at this for essentially copying, like Tennessee did look at other states on how they ran their syringe service programs and the fact that they were passing in red states. And so then Tennessee took that as like a sign that they could also get it passed, and they did, from a Republican legislative standpoint. So I think in terms of like looking at other states for copying legislation, that is true. But in terms of financial impact, I think they kind of only just look at their state, and then everyone else be damned. So.
So,
Is there legislation that could be passed to protect this kind of money or protect this kind of system?
Yeah, there was a couple of lawmakers that introduced a bill that would basically require the states to, if there is, federal funding, to be out there to accept it. It was introduced by a Democrat, which pretty much already made it a dead bill in the state of Tennessee. So there's a legislative way to make it where they would have to accept the money, but it's going to pass. And if it does pass, it's probably not going to pass in time for the May 1st deadline.
Oh, well, it's we're coming up on the end of time, but I think that one of the things that I would like to maybe task the CEG policy team is really looking at this cost impact on the borders, because I do think that is we certainly see that around the opioid crisis. We certainly see that around reproductive health as well. So I think that this is an opportunity for us to maybe have that begin to have a different kind of conversation about what we need to do. But I also, Cory, I want you to know that we are here as much as we can be here and to support you and to figure out ways in which we can help. I think that, again, I don't think any of us are in this line of work because we wanted to get rich or be beautiful. But because we wanted to, okay, some of us are beautiful. But I think that, we wanted to help people, who were living with HIV, substance use disorder, and hepatitis be able to live higher quality lives. That's, I think that's why we all do what we do. And so when we have things like this that occur that impact people's lives in this way, I think that that's where we have to rally the troops. And so I want you to know that we are at the ready for whatever you need us to do and how you need us to show up. I don't think it's always our job to show up in ways in which we're not asked to, but also I want you to know that we are a phone call away. I think that I also want to say, I think, as I've said or articulated a few times here, I think this is the tip of the iceberg. I think we're going to see this more and more. I think that Lynn hit the nail on the head. I think we have to have conversations about the financial impact with our state partners and how this is going to bleed over boundaries. I'd like to thank our folks and our partners at both ViiV and Merck for having a conversation with us. If you guys want to be able to access them for both public policy opportunities as well as, I don't know if you guys want to put in the chat contact information, Dawn, of how to get in touch with you or how to access the grants portal to write a grant for Merck for policy, not keeping the lights on. I remember that very clearly. We can do that as well. But again, we don't get this done without each one of us. And in this region of the country, I think we all know better than most that we, stick together with each other. And so, Cory, I really want you to know that we really are with you. This isn't just a dog and pony show. We really do want to help figure out how to turn this around. And if we can't turn it around, how do we augment support in this region of the country? Because I agree with you wholeheartedly. I worry the most, not about, unfortunately for you, not about organizations like yours, but I worry about those mom and pop shops that I call them that are, $1 million and less that are out there kind of doing that day-to-day work that, we got to figure out how to keep their lights on so that they're doing the testing, the linkage to care and being the kind ear that folks need. So let's stay in communication and let's figure out ways in which we can help you and help those organizations as well. So I think folks have put their contact information in the chat if you want it. I think it'll also come out with the notes from this call. And I want to say thank you, everybody, for taking time to spend another hour of your week with us. And again, show up on the 27th. We're going to have a rock'em sock'em time. with me and Chairwoman Gail Manchin. It's going to be a party not to be missed.